Hi, I'm Dr. Hynek McFarland. I'm a general surgeon and the medical director of infection prevention here at Greater Regional. And I want to talk to you today about some of the differences and similarities between flu and COVID. So they're both contagious respiratory illnesses that are caused by different viruses. Symptoms can be pretty similar between the two. They can both cause fever, cough, body aches, and sometimes vomiting and diarrhea, especially in kids. They can also both cause pneumonia. And because the symptoms can be so similar, testing becomes very important to help differentiate between the two, because that'll help us direct our treatment. Symptoms of either can range from mild to severe or even be fatal. Data has shown that the rate of COVID deaths is about 6 times higher than flu deaths, but the good part is that a significant amount of COVID positive people are completely asymptomatic. So that becomes really important when we're talking about preventing the spread of illness. So how do they spread? Both spread by respiratory droplets. And so the most common ways that happens is through coughing, talking, sneezing. Somebody inhales that droplet or they get it on them and they get infected. Same way with shared surfaces. So if you touch a shared surface that has that droplet on it, you touch your face, you become infected. It's important to remember that when people are infected with coronavirus or flu, they might not realize they're infected for several days and they could be passing that unknowingly to other people. So prevention becomes really important. It's important to realize that people infected with coronavirus or flu can be sick for several days before they're exhibiting symptoms. So you could be spreading the viruses to other people and not even realize it. And so for that reason, prevention becomes very important. So how do you prevent both of them? It's very similar. Both can be prevented by wearing a mask, frequent and thorough hand washing, coughing into the crook of your elbow, and especially staying home when you're sick and limiting contact with other people who you know are sick. Also, physical distancing is important, especially in limiting COVID in communities. Regarding treatment, so neither COVID or flu are treated with antibiotics. So they are viruses, and so they're not bacterial infections. They're primarily treated by addressing the symptoms. So you want to reduce fever. Severe cases, people might need to be hospitalized or even end up on a ventilator for either illness. For flu, there is an oral antiviral medication that can help to address your symptoms and sometimes shorten the duration of illness. With COVID, the only antiviral treatment available is IV form, so that's reserved for hospitalized, severely sick patients. Regarding vaccinations, development and testing for a COVID vaccine is in progress right now, but at this time there's currently no vaccine available. Regarding the flu, there's obviously a flu vaccination available, and it's effective in preventing some forms of the most dangerous types of flu. But even if you do get flu, it's been shown that it decreases the severity of the illness, the duration of the illness, decreases your risk of being hospitalized or dying, especially in those high-risk age groups. So it's important now more than ever to get your flu vaccination this year. So where can you go to do that? You can contact your public health and set up an appointment. Otherwise, talk to your local pharmacies. Some of them are offering flu shots as well. So all of this information is coming off of the CDC website. If you have any other questions, please reach out to Greater Regional on our website.